And then others. We talked about this 20% of original content posted to Facebook page was in this other category. And some of the things we saw were contests. Recipes was pretty popular, healthy recipes. So Scripps Health sharing a low-sodium barbecue sauce recipe, something we should probably all look into. And maybe it was just a link to another social channel. So St. Jude just making their audience aware that, hey, we also have a Twitter channel, and you can find valuable information there. And some other items we saw are podcasts, radio recordings, surveys, maybe a module for a live Q&A. Patients of the month was also something we saw that made up this 20%. So plenty of ideas here for how do you produce original content. So moving on, so the next category of posts we saw from hospital community were external content. And we saw this break down into 6 categories. 60%, really the majority, made up with news. And but then we also saw health tips, external video, awards and recognition being given to the hospitals or health systems, external blogs, right, other people's blogs, and then just other. And I'll go into some subcategories of these so you get an idea of what we were looking at. So in terms of external news, a lot of times it could just be, Penn State Hershey received a very sizable grant, to study asthma. So they wanted to share, an article from the Central Penn Business Journal. Or maybe there was a feature on a class at Evergreen Hospital, right? So and this is a great plug for social listening, or I'm sure your hospital system has some type of news monitoring system. But just as a way to stay on top of what's being said about us in our community and what would we want to share back through our social channels. Health tips don't necessarily have to come from within the organization. I love this one. Children's Mercy Hospital shared a recall from Kellogg. They said, you know what, this recall notice is very relevant to our audience, and we're going to share it. Or it could just be, sharing something from Dr. Oz. These externally validated health tips that don't necessarily come from your organization, but that are perfectly appropriate to share with your community. External content. So maybe there's videos that you didn't necessarily produce yourself, like Children's Hospital Central California had an interesting fundraiser where they did a bloodless Portuguese bullfights, right? And maybe they weren't necessarily there to capture video themselves, but someone that was in attendance created a video, and then they reposted it. Again, if you have a good social listening program in place, and you're doing events, walkathons, you'll be able to basically tap into all the media that other people are creating around your event, and then use your official channel as a place of reposting it. Recognition, this is an obvious one. So if Miami Children's Hospital has programs lauded in the local newspaper, in the Miami Herald, they're going to want to repost this. Or you make one of the U.S. news lists, right? This is a perfectly appropriate place to post this. We saw about 6% of the external posts were in this category. Blogs, so reposted, the wellness blogs in the New York Times. And then finally others. So maybe it's promoting, recipes from an external organization that's necessarily attached to your hospital, or producing a contest in conjunction with a local business and promoting it here. So the third event type, and so we're getting into back to the posts from hospital community. About 20% were pertaining to events, and I've kind of listed out all the different types of events we saw. So classes, seminars, blood drives, maybe even a company outing. Health screenings that are going on, support groups. This is a phenomenal place to promote events that are going on relevant to your hospital community, and we saw about 20% of the posts pertaining to events. And don't forget to take advantage of Facebook's event feature if you can, like this example from Holland Hospital, promoting a health series. Announcements. So 12% of the posts were just general announcements. So this could be, special hours from, Hospital St. Raphael, just saying, hey, we're going to be closed. Our clinics are closing on July 5th. Obviously, Facebook shouldn't be your only channel for making these types of announcements, but don't forget that this is a channel that people have elected to connect with you with, and a perfectly fine place. Maybe if you just want to announce that you raised a certain amount of money, or you received an accolade or an accreditation. Also, these are perfectly great places to make that announcement. 6% of the posts were conversation starters. And what is a conversation starter? So it could be a holiday greeting, right? Just we want to wish all our veterans, a happy Veterans Day. A topical question for Scripps Health. This was, wow, it's almost back to school time. Are you feeling ready, or could you use a few more weeks before your kids head back? Does this have anything to do with the hospital itself, or is this health related? Well, I guess if you're a mom, or a dad, sending your kids back to school could be health related, right? But it's more just to generate conversation, get people engaged, just showing that you have personality. Maybe it's a trivia question, general inquiry, what makes your Mondays great, or call out for stories. This is a great one, right? Have you had an experience with our hospital? What difference did it make? Was there an employee that really stood out to you? So, I actually would have liked to have seen even more of these posts be conversation starters, because they're easy for your hospital to do, and they get a lot of engagement, which is really the point, right? And then finally, 5% was employee recognition. And we saw this take a couple different forms. We saw spotlights, right? We talked about spotlights, just kind of a text spotlight. Talking about departures. So, Rush Medical, Rush University in Chicago, we're very sorry to see this referrals manager leave, and they used a public medium to say farewell. Just again, giving your organization a bit of personality. Maybe you had an RN win a Daisy Award for extraordinary nurses. Great place to call it out, right? We have an amazing staff, and we want to share it. Or maybe you've hired someone new on that you want to tell the community about. Also, we saw a lot of these employee recognitions. And so at this point, I see some great questions are coming in, so keep them coming, and we'll have a Q&A at the end. So now we'll get into the deep dive, the posts we saw from community to hospital. Right? What were the reasons people were posting to hospital Facebook pages? And so 36%, a significant amount, were just compliments, right? Great facility, so compliments on facilities. Maybe a thank you to a specific staff member. I thought this was amazing. Thanks to Dr. Robert O'Toole for rebuilding my husband, in 2007. We talk a lot about what's the return on investment for putting time and energy into maintaining and creating a Facebook page, right? I'd ask you to think about what is the value of a comment like Denise's. There's it's tough to quantify, right? But we all know there's a real value for having something like that. Or maybe it's just, website compliments, someone who, got good information, from a specific website. So this is a really interesting one that we did not expect. So almost a quarter of posts from the community, a quarter of the 1,500 posts we looked at from community to hospital were what we call self-promoting. So on one end of the spectrum, pure spam, right? People, and I probably should have blanked out this person's name, but, just kind of, it's not total spam, but it's really just, someone who has something to really gain monetarily from posting to a wall, like a service they run, or a herbal supplement they sell, and just posting to the hospital page to promote it. Links to other Facebook profiles is something we saw. So maybe it was just prayers for Delaney. So someone who's clearly at this hospital, and they wanted to make other people aware that their sister or their mother was at this hospital. Maybe there's a fundraiser in the community, like this Swimming for a Great Cause that Sarah thought would be relevant to people who were attached to their hospital's fan page in Buffalo. She thought, think of this like your local coffee shop that has a bulletin board where people go and post, local events and announcements. That's really how we saw people treating hospital Facebook pages. We thought this was interesting. And so I pose it to you, how do you cultivate more of this? Because people are clearly seeing this as an outlet and something valuable to them. Or maybe it's just reaching out for support on a project. Conversation starters. So we saw community members doing the same thing that the hospitals did. So reaching out, this is a child saying, my mom works in postpartum, her name's Chris Rowe. Just want to put it out there, well wishes. So someone from the community saying, have a hugely successful event. I love this. Some Kathy just sharing an inspirational quote for maybe there are other patients that are coming to this hospital's Facebook page, and she just wanted to share a great quote from Lance Armstrong. or maybe just a greeting. Just want to say hello to other people who are coming to this Facebook page, other people who are part of my community that are also connected to this hospital. And again, how do you cultivate more of these? I think that is a great location for these. Questions. This is one. This is probably an obvious one, or maybe not so much. But we thought we'd see a lot of people coming to hospital Facebook pages with questions, and it made up about 11%, and they broke down into these categories. So just general inquiries, and this one actually you can see is coming from an employee asking, do we have a take your child to work day? Medical inquiries, which you figure you're not going to get too many of. People probably have better avenues for asking medical inquiries, but you never know. This person's asking about seasonal flu shots. And it's great, actually, that they're asking this question publicly, because chances are other people have this question. We can't find anywhere in town to get our 7-year-old a shot this year, right? Probably a lot of other people in that community that have that same question. So encouraging more of those questions. Maybe it's just contact for an info request, or someone searching for a specialty doctor. Looking for an eye and ear specialist for my father. Can you recommend someone, please? If you're seeing a lot of these posted to the wall, maybe you can create a custom application that is a referral application. And we also saw people asking about employment, volunteer inquiries. Photos and videos really didn't make up much of what we saw. Someone posting a photo of a child that was recently born at this particular children's hospital. We saw a handful of suggestions, not a lot, but this woman pointing out that the entrance to parking area is too congested and crowded, right? Social media is an awesome place to take the pulse of what people are saying about my organization and to learn from it. So this is another thing you should cultivate. Instead of waiting for people to post this, on a more regular basis, post. What can we do better? What would you recommend? Don't be afraid of it, because we see at number 2%, 2% of 1,500 were complaints. I didn't even have a good example to share. There were so few complaints, which I found almost a bit surprising. And I just got a question. Someone says, can I be unmuted? I'm unable to hear anything. So if you're having trouble, I guess if anyone else is having trouble hearing, please just use the chat functionality or pose a question. But I figure most people are able to hear me okay.